Hey mama, I'm going to give you a cheat sheet that's going to make every prenatal visit appointment 10 times better. Okay? I'm going to give you 5 questions that you're going to ask your provider at every single doctor's appointment during your pregnancy. This is going to help prepare you for childbirth and even prepare you for the postpartum period. Okay? My name is Dr. Cho. I'm a postpartum physician and a postpartum advocate working in Atlanta, Georgia. I run the company EM Care to You, and I love preparing my pregnant moms for childbirth and the postpartum period. Okay, so here's the cheat sheet. You ready? I hope you have a pen. All right, number 1, at every doctor's appointment, I want you to make sure you ask your doctor, how is my baby growing? Is my baby's growth on track? I'm 20 weeks today. Is my baby's growth appropriate for where I am in my pregnancy? This is really important because you want to make sure that you stay on track of what is going on, not just with yourself, but also with your baby, so that you may be aware, you may be alert, and you may be able to take the precautions and prepare yourself for what is to come next. And so definitely ask your doctor how your baby's growing. You could even ask about, at this stage of pregnancy, is my weight where it's supposed to be? Is my belly growing appropriately? And what concerns do you have about baby's growth or my own growth? All right, let's move on. Number two question that you're going to ask your doctor is, what screening tests are coming up? What screening tests are coming up? Why is this important? At every visit, you and your doctor are going to be doing different things. So at 12 weeks, you're going to be, confirming the baby's pregnancy. You're going to be checking to see if there's any abnormalities with the baby. At 20 weeks is what they say an anatomy scan. They're going to take a look if the baby has 10 fingers, 10 toes. Along the line, you're going to have, screening for gestational diabetes. There's so many things, blood tests that you are going to undergo during your pregnancy. And so you want to be prepared in advance for these things. And so if at 20 weeks, this is what's going to happen, you want to make sure that you are planning in advance of that procedure. And things that matter may be, do you need to be fasting during that time? Do you need to bring any information? Do you need to bring your partner? All of this is really important. And I always advocate for moms to keep a folder, write this down. And in fact, if you go ahead and download my cheat sheet, I have an area where you can take notes. And I'm going to put that in my comments below. Okay? All right, let's move on. Number 3. Number 3 is really, really important. And that is, what red flags should I be looking for at this time? We know the statistics. We know what is going on in our country with maternal health. And so an informed mom is an empowered mom. So I want you to take a moment to sit down with your doctor and have them talk to you about what you should be looking for, because it differs at every stage of pregnancy. In your first trimester, we worry about nausea, vomiting, we worry about significant bleeding, abdominal pain, especially if you haven't had your baby checked with an ultrasound. We want to make sure that the baby's in the right place. And so that is not as much of a concern in your second or third trimester. In your second or third trimester, there's going to be significant abdominal pain, there's going to be bleeding, there's going to be headaches, which can signify elevated blood pressures, there's swelling in your face, swelling in your hands. And so as a mom, I want you to take the time to study what red flags exist at that point of your pregnancy. And this is going to help you stay in tune with your body and to be able to have these conversations, to talk with your doctor and feel that you are getting things addressed in a timely fashion and you are aware of the things that you need to be aware of. Number four, this one is a good one. How do I prepare myself or my body for labor? Right. In your first trimester, you're not worried about pushing out a baby right now. It's too early. You're just worried about getting through the nausea, getting through the fatigue. And so what exists in your first trimester for preparing your body for labor may be eating healthy, maybe moving your body, maybe taking your prenatal vitamins. In the third trimester, preparing your body for labor is going to include certain movements. It may include maybe seeing a chiropractor. It may include, going to do some stretches, doing some prenatal yoga to open up the hips, some perinatal massages, practicing how to push. And so have these conversations with your doctor, because you don't want to be surprised when you get into the labor room, and you want to make sure that you've done everything that you can to prepare your body for labor. And that can be physical, that can be emotional, that can be mental. We want to walk into our childbirth prepared. And lastly, the last thing I want to talk about is ask your doctor how you can support your mental health. Why is this important? Pregnancy unleashes all sorts of hormones. And once you deliver that baby, everything is out of whack, right? There's significant drops in your hormone levels. A lot of women are going to struggle with baby blues. A lot of women are going to end up having postpartum depression. And so you want to be in tune with your mental health during your pregnancy. You want to stay alert and aware, and you need to find ways to safeguard that mental health. And so talk to your doctor about how you're feeling. Are you anxious about what's going to happen? Are you feeling depressed? Are you having significant challenges with your husband? Are you having significant challenges with support? And what this does, it helps your doctor and you come up with a plan so that you can tackle how to safeguard your mental health. It starts during pregnancy, moms. Some people get through pregnancy and they're just fine, but in the postpartum period, they struggle with postpartum depression. But some people experience mental health challenges during pregnancy, and we don't want to miss those. We want to make sure that we have a plan entering postpartum so that you are not at risk for severe postpartum depression, and that you have a plan to tackle this. All right. I didn't tell you that I had a bonus. I have a bonus piece of advice for you. Okay. And that piece of advice is, I want you to ask your doctor who you should be meeting with during this time. What do I mean? Okay. I tell all of my moms that they need to meet with a couple different people. I want them to pick a pediatrician before postpartum. Why? Because moms have a lot of choices about how they want their children to be treated, right? For example, some moms want a delayed vaccination schedule, or they may not want to vaccinate. Some moms don't want to receive vitamin K or, erythromycin, or they don't want to, receive certain treatments. These choices can affect your relationship with your pediatrician. There are many clinics in the US that will not take your children if your children are not vaccinated, or will not take your children if your children did not receive vitamin K. And that's, that is their policy. And so what happens is a lot of women end up feeling blindsided by that. And so you typically need to get your child seen pretty quickly after giving birth. And so if you don't have a relationship where you haven't picked a pediatrician, you're going to have a really challenging time. And so I always encourage moms to meet with a pediatrician. Next person I usually tell my moms to meet with is a lactation consultant. Why? Because you don't want to be struggling with breastfeeding, if there was something that you could have tweaked, something that you could have worked with or figured out in advance. Or if you're like me, I suffered from a condition called glandular hyperplasia, where my glands did not grow during the prenatal period. And so what that did is that in the postpartum period, I just thought that something was wrong with me. And so I pumped like a maniac. I had severe postpartum depression. I thought that my breasts didn't work. And then only after weeks of struggling and crying and being in a depressive state did I get a lactation consultant who came to my house and diagnosed me with glandular hypoplasia. If I had known before I gave birth, I would have been mentally prepared. And maybe I wouldn't have beat myself up so much trying to pump and make my breasts work when I had a medical condition. And so there are a lot of people who have medical conditions that will make breastfeeding difficult. And so I always require moms, or ask moms, to please go meet with a lactation consultant, because you never know what they can pick up in advance. And then lastly, the last two people that I always say meet up with, one is a pelvic floor therapist. Why? Because, mom, your pelvic floor is undergoing some serious stress in carrying that baby for 9 months. And so, a lot of moms postpartum end up with urinary incontinence, which is not normal. You end up with difficulty with constipation, hip pain, back pain. Your pelvic floor has undergone stress, and pelvic floor dysfunction can lead to a lot of issues that a lot of moms won't realize are related to that. And so, just like you work out your body, and just like when you decondition, you don't work out for a while, you got to get back in the gym, you got to lift up those weights. Your pelvic floor also requires some rehabilitation. But there's some things that you can strengthen, some things that you can do to strengthen your pelvic floor in the prenatal period to make postpartum even better. Okay? So that is all the advice that I have for you today. I want you to walk into pregnancy. I want you to walk into every prenatal appointment with your cheat sheet. You can get it and download it below. You're going to ask your doctor all this information, and truly, truly, it's going to make your experience much better. Okay. And of course, if you need more support, you need more planning, I offer a postpartum planning session for all my moms. And what I do in that session is we talk about, your postpartum. We talk about preparing your body for childbirth. We talk about the people that you need to meet with. And I prepare a plan so that you can get through that postpartum period. And of course, if you're in Atlanta, Georgia, and you want total care, you want a postpartum physician who works just for you, who's going to be there for you, be available 24/7 to be able to help you navigate this time in your life, please call me. You can reach me on Instagram at Dr. Choa, or you can just message me below and I'll send you some information. Okay? All right. Well, it's been great talking to you. Please hit the subscribe button. Follow me. I'm going to be coming up over here and talking about more pregnancy and postpartum tips. So excited to educate you all. My name's Dr. Choa. I'm a postpartum physician in Atlanta, Georgia. Take care.